They announced the first cases of COVID-19. I felt alarmed, and I felt the urgency to do something. I felt really enthusiastic to share information. So this is how I came up with the idea of the radio program. Through these programs that we are doing, we are making our community safe, we are making them healthy.
One of Nigeria's biggest slum communities, called Ajegunle, is home to more than 3 million people. So we needed to act. And being a part of that solution is actually one of the big things that motivates me.
Jivika is the name of Bihar Rural Livelihood Promotion Society. It was constituted for poverty alleviation and started organizing women into self-help groups for building communities. The moment the COVID pandemic was declared, we started communicating with our SHG members, making them aware about the pandemic. So this entire process was such a community-led program and majorly taken up by our SHG members. Our SHG members have shown their abilities to deal with the situation.
Incas Diagnostics is involved in development and manufacturing of rapid point of care tests for sub-Saharan Africa. With COVID, we wanted to get people tested so that we could isolate people and then get back to normal activities. This pandemic has actually brought to the fore the fact that a lot of people are willing to step up and do good.
Here at Project Together, we're building a new process of how we can solve some of the most pressing issues of our time. COVID obviously had quite a detrimental impact. We started thinking about organizing a hackathon. We had a response from the German government that we should go ahead with it. So we have supported 130 solutions that came out of the hackathon, and multiple projects are now working together to really help the public and our medical system, and this really gives me hope.
我们跟缅甸有2000公里的边境，蚊子它还可以通过2米的距离飞过来。 这传染病是没有国界的，我们一定要说国界。现在新冠来了以后，大家就明白了，根本不是那么回事情。那国界跟传染病没有任何的这种关系，一定是要综合的考虑这样的问题。
Rwanda is the first country in Africa to have digital health as part of their healthcare service. We have built a platform to work with any mobile phone, accessible and affordable in the same manner to everyone. We know that digital health can provide some solution so that the really critically ill stay in hospital and then everybody else can be treated from home.
COVID-19 affects the lung. The first treatment is oxygen. So at the beginning of the pandemic, we were approached by the government to prepare to scale up the supply of oxygen. My hope is that Hewa Tele will meet the oxygen needs of all our health facilities during this COVID-19 pandemic.